Hello everyone, I'm Preeta from Group 25. This is patient Mariam. She has chest tubes and I'll be demonstrating nursing assistant care for this patient. Hello Miss Mariam, I'm Preeta, your nursing assistant. How are you? That's great. I will be checking your vital signs right now, so don't worry, just be relaxed. You're good, don't worry. I will check your pulse right now. Breathe in, breathe out. Breathe in again. Breathe in, breathe out. Breathe in again. Alright, your heartbeat is good. I will check your incision part. Let me know if you have any pain, okay? Is it painful? Do you have any pain? No? Alright. So, what is chest tube? A chest tube is a hollow, flexible tube placed into the chest. It acts as a drain. Chest tubes drain blood, fluid, or air from around your lungs, heart, or esophagus. The tube around your lung is placed between your ribs and into the space between the inner lining and the outer lining of your chest cavity. Chest tube is inserted. You will lie on your side or sit partly upright with one arm over your head. Sometimes you will receive medicine through a vein, intravenous or IV, to make you relaxed and sleepy. Your skin will be clean at the site of the planned insertion. The chest tube will be inserted through 1-inch cut into your skin between your ribs, and it's guided to the correct spot. The tube is connected to a special canister and suction is often used to help it drain. Other times, gravity alone will allow it to drain. A suture and tape keep the tube in place. After your chest tube insertion, you will have a chest x-ray to make sure the tube is in the right place. The chest tube most often stays in the place until x-ray shows that all the blood, fluid or air has drained from your chest, from your lungs and fully re-expanded. The tube is easy to remove when it's no longer needed. Some people may have a chest tube inserted that is guided by X-ray, CT or ultrasound. Some people may have chest tube inserted that is guided by X-ray, CT or ultrasound. If you have a major lung or heart surgery, a chest tube will be placed while you are under the general anesthesia during your surgery. What is a chest tube used for? You may need a chest tube if you have any of the following, such as a collapsed lung, a lung infection, bleeding around your lung, especially after a trauma such as car accident, fluid buildup due to another medical condition such as cancer or pneumonia, difficulty in breathing due to buildup of fluid or air, surgery especially at the lungs, heart or esophageal surgery. So, inserting a chest tube may also help your doctor to diagnose other conditions such as lung damage or internal injuries after a trauma. There are serious complications that are rare, but they can include bleeding into the pleural space, injury to the lung, diaphragm or stomach, and collapsed lung during the tube removal. The chest tube insertion puts you at risk of several complications. This includes pain during placement. The chest tube insertion is usually very painful. Your doctor will help to manage your pain by injecting an anesthetic through IV or directly into the chest tube site. You will be given either general anesthesia, which puts you to sleep, or local anesthesia, which numbs the area. Next is infection. As with any invasive procedure, there's a risk of infection. The use of sterile tools during the procedure helps to reduce this risk. Next complication is bleeding. A very small amount of bleeding can occur if a blood vessel is damaged when the chest tube is inserted. And the last one is poor tube placement. In some cases, the chest tube can be placed too far inside or not too far enough inside the pleural space. The tube may also fall out. These are the complications. Now I will demonstrate and explain more about the chest tube.
I'm going to check to make sure that the tube is taped and secured to the body in 2 separate places, which it is. I'm going to continue down the tube to check the connections to make sure they're secure and taped. I work my way down to the clamp. It's clamped for demonstration purposes only. In the hospital, you will see this. But because the mannequin has no negative pressure in their lung cavity, we have to keep it clamped for us to show you how to assess the chest tube drainage system. The chest tube must be smooth along the side of the patient on the bed, no dependent loops. This is a dependent loop. We don't want this. So we make sure the connections are good. We check the bellow to make sure suction is on and continuous. And as you can see, when I remove suction, the bellow disappears. When I reconnect suction, the bellow reappears. This is the pressure that it's set to. This is done by physician orders only. Next, we check the water chamber to make sure that the water level is equal to 2 centimeter mark here. If it's not, we need to add water or remove water. You check for bubbling. We don't want bubbling. Bubbling means there's a problem with the connection. Also, with the breath sounds, you will see a rise and fall of the water level, plus this little ball in here will rise and fall with each breath sound. For the drainage system here, this is where the drainage comes. You never empty this. It's a continuous collection of drainage. With each shift, you'll mark it with either tape or a marker, time and date at the level it is when you end your shift. Tape, in case you need to reinforce the chest tube. You're going to want saline in case the chest tube becomes detached or tubing comes loose, and you want to submerge it into the saline to keep it sterile or clean. You're also going to want some Vaseline gauze in case the chest tube gets dislodged or falls out, that you can plug the hole with the Vaseline gauze. Also, when you do transport the patient, what you're going to do is there's going to be hooks on the drainage system. You pull these hooks up. You hang it low, right here. You don't put it on the bed with the patient. You always want to keep the level below the patient. And then you just remove the suction, and it'll be to gravity.